Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, we're talking about sexual health, stigma, and the systems that need fixing, particularly when it comes to making healthcare truly accessible for marginalised and underserved communities. We're going to be talking about co-design, respect, and rethinking what patient-centred really means when the system itself can feel unsafe or exclusionary. Joining me today are three people who bring very different but complementary perspectives to the conversations. James Sneddon from Hyphen Health, plus Harper, Valentine and Nova Hawthorne, who are two fierce advocates and creators who live and breathe this space every day. G'day team, how are we going?
Hi.
Hello.
Great to have you here. James, no stranger to Talking HealthTech, but some new faces on the feed as well. So I'm looking forward to diving in and really unpacking this one today. James, maybe help us set the scene. We've spoken on the podcast a couple of times before about Hyphen Health and your mission to break down that stigma in healthcare, particularly around sexual health. For those that are unfamiliar, though, tell us about the work you're doing, what you're seeing on the ground, maybe what's happened since we've last spoken, and why this problem's so urgent to address now.
Yeah, so 10 years ago, I founded Hyphen Health, and we now incorporate 4 virtual clinics, websites that allow patients to activate healthcare on their own terms. And the 4 clinics are Stigma Health, Hey Fella, Prep Health, and Road Safe. And they're all about attacking these awkward or embarrassing or inconvenient reasons to see the doctor, from STI testing through to steroids. And that we organise testing to ensure everyone's safe and looked after. And collectively, our 3 sexual health clinics are Australia's largest sexual health service because people don't want to see the doctor in person about this stuff. Yeah, the current guidelines, that's an issue with them for, I think, especially for our sex workers. STIs are on the rise, and it's been documented. The media likes to report it too. And the issue is people are not testing enough and not getting treated enough as a result. And with most infections in the community are actually undiagnosed, which causes real problems. And people aren't getting tested for all those reasons. People use our service. They can't talk to the doctor because of their psychosocial, cultural, including cultural or other issues, or just convenience, or the doctors, you got a wait time, a due date. And then guidelines for sexual health are we should test high risk people quarterly, which just doesn't work for the sex worker adult industry. They're working with guidelines, industry guidelines, which are far better, and they're also we can't. A positive infection in the community is downtime, no income. It can really hurt, especially if, say, you're a survivalist in the space, or just anyone earning an income. Like, you don't want to be not able to go to work for something that we could be more on top of with better guidelines.
Yeah, look, I mean, that's what we talk about so often on the Talking Health Tech podcast around creating a safe space for people to talk about things that they aren't comfortable talking about but need to be addressed. And often a lot of those things happen in the healthcare sphere. So important conversation for us to be having. And sounds like there's still a lot more work to be done. Harper and Nova, I feel like this episode is probably not going to be your typical conversation you find on this feed about data interoperability or the importance of cybersecurity. But there are probably some alignments with previous themes and things that we discussed. Maybe it'd be great if you could both give a bit more context and introduction about the work you do. Maybe Harper, will start with you.
Sure, yeah. So I am a sex worker. I've been a sex worker my whole adult life. And I suppose in that time, I've done a lot of things. But really, I would mostly just consider myself someone who's had a lot of social mobility, come from a really unique place, and moved through a lot of stigma and issues myself. So now I both try and use that information that I got along the way to help people, and also use the privilege I have now in every aspect, hopefully, to help other people do the same or help people in the situation, in the space that they're in currently. So yeah, I'm a sex worker and an advocate focusing around those things.
Wonderful. Thank you. Nova, what about you?
I come from a really cool place. I'm a sex worker with a formal education in social work. I started my sex work career when I was at university and actually faced a lot of discrimination through higher education, which was quite an experience in itself. So I like to say I sit at the intersection of lived experience and systems knowledge, which is really neat. And with that, I've been using my knowledge and my experience to focus on helping other sex workers to be more in control of their economic experience. That's something I'm really passionate about, taking control of their career journeys. And so I've been doing a lot of things, mentoring sex workers to help build their income streams, navigate their systems, the health system sometimes, legal systems, the financial sector. And then I get to partner with people like Harper who have similar ethics and morals to create events, and we create quite meaningful events as well.
Interesting. And I guess I think about the breadth of the audience of Talking Health Tech, and people come from different experiences and perspectives, and I guess understanding of what people do and say the sex work in industry. And maybe if I stick with you, Nova, for a second, I guess it's not an industry that, like, for some people, as both Harper and Nova were explaining, then they might go, well, hang on a second, what are we talking about? Like, is this or across all the spectrum? Some people will be like, well, is this even right what we're talking about? Others will be like, yeah, for sure, we need to have this full structure. It sounds like this is a more structured industry than what some other industries are that exist. Maybe give some more context around that for those who aren't totally familiar with I guess this space of sex work in Australia.
Yeah, so sex work is basically the overarching umbrella term for a lot of different things underneath it, which includes in-person work, which would be your full service sex work. So that could include things like brothels, street-based sex work, independent escorts, and that kind of physical sexual services. And then you've got things like stripping and performing that happens in clubs or happens at private events and venues. You've got porn, you have independent content creators who work on platforms that sell subscription-based models. You have people that do professional porn that work for studios. Harper, am I missing anything there?
Yeah, so you've done pre-recorded and then there's live. Ironically,
Yeah.
So live digital media, and then pre-recorded digital media. So live, like camming or streaming of a whole variety. There's a million different ways you could stream. Yeah, I think that's the only
also and then there's fetish and more taboo.
Of course, yeah.
Realms of sex work.
But then you can go into a bunch of different niches and a few different things. So you might be in person, but fetish. So we wouldn't consider that full service because you're not offering a sex service. You're offering a niche fetish service. So depends on the person. You might consider it full service or you might not, but you're not having sex with the person that you're seeing. It just depends on the person. So there's a million different variations of all of these things that you could do. But yeah, there's in person where you're touching, in person where you're not touching, online pre-recorded, and then online live is covers majority of the things that we do.
It's funny, we were chatting before we were recording, and we were comparing stories of content creation and monetization, how similar the business models were between Talking Health Tech and what you do. So I guess I can relate in a strange way into what you've said. And there's a lot of, I guess what I hear from that too is the diversity and complexity, and probably the understanding that a lot of people who might engage with the industry or be influential to it may not fully understand as well. So if I was to put this in the context around healthcare too, and what you're seeing, maybe Nova to start, thinking about what you see, this disconnect between traditional healthcare models and that kind of lived experience of sex workers that you mentioned before and marginalized communities. What is there a connection? Is there a gap? Like, help me make that bridge that gap.
Yeah, I think for a lot of sex workers, it's not about the healthcare services don't exist. Like, we know they're out there. The challenge is finding ones that sex workers feel safe to access, that they feel welcome to, that service is tailored for them, that they have the understanding of what our work is, and they're not going to do things like some traditional healthcare models. I've been to a GP and they've not really understood what my work encompasses, which has led to some really invasive questions that have made me basically switch off and think, this person does not understand what I'm talking about. I don't think I can have a good professional working relationship with them. So I've been treated like our work doesn't matter, like it's not important. If I've had a health concern, that it's not important or brushed off and not taken seriously. So with online services, they really are tailored and understanding. Like, they really have much better than just background knowledge or general knowledge of our work.
Yeah, I
Yeah.
think ironically, I think everyone's heard sort of growing up from your parents, and people say to each other this concept of, you go to the doctor, don't worry, they see it all. Don't be embarrassed. Don't feel awkward. They see everything. They do this every day. And ironically, sex work related doctor's visits, or just sexual health related doctor's visits, because I'm a sex worker, is the only time that has ever not been true. It has been awkward, and it's suddenly becomes like a social interaction rather than a professional medical interaction, and it's awkward for everyone. And it's the only time I've experienced that. It's really interesting.
Yeah, there's probably something in the whole, there might be like all good intentions on a primary care physician side, or even maybe caught off guard. I don't know, but the people respond in different ways to different scenarios, which can not be helpful to, I guess, the real problem to be addressed, or the issue at hand. So that's super interesting to reflect on. And James, when I think about that challenge of like that disconnect between, say, a patient and a clinician or the system, often we talk about this need for co-design a lot in healthcare, where we look at, well, let's build solutions together with all the parties involved so everyone can feel, I guess, included and respected. How do you think about this whole, I guess, challenge right now of the current healthcare system? And you've obviously built out over the years through the work you've done with Hyphen Health to address the really pointy end of the stigma related type challenges. How do you think about co-design and respectful co-design, and what we actually need when I guess well-meaning services still get it wrong?
Yeah. So, look, co-design is just essential in healthcare. A lot of services. So when we started this service, I started with Dr. Mitchell Tanner. He was the GP, and really I was the patient I had in mind. Young, single, 27 at the time. So it's a 10-year journey now. But then as we go along, I meet Harper, I meet Nova, and we identify the cohorts, and we identify who we need to help. And from there you develop that, they have different needs to what I do. They have similar issues, but then they need the results immediately, frequently. They need responsiveness, and they need empathy, as well as understanding. And then before we develop things, or if we develop things, we communicate with them up front, asking about, is this valid, and some of those things. And Harper and Nova give me a list over the time, and I haven't developed all of them, but I try and give them the feedback as to when it's coming, or why we can't do it now, or the issues. And sometimes, a lot of times, we face issues with, the guidelines. Like guidelines, for example, testing, MGen, microplasm genitalium. It's needed for the sex worker industry. The guidelines don't ask you to test it unless it's symptomatic. That's too late. You're then losing work, losing money, and losing downtime. So, but I get that feedback from, my little feedback loop of Harper and Nova in this network. We ask for feedback from all customers at various stages in the process, and we're trying to build out a wish list of what they need from their involvement as well. And then we're trying to immerse as well and support the community more, We're attending the events, seeing people in person, which is really starting to help too. And getting the team along to that is getting the team into that insight, because it can't just come directed from me. It needs, that empathy needs to be at the customer service level right through. And yeah, I briefed you last time. My first 30,000 patients for Stigma Health all had my mobile number, because I was the only one answering the phones.
I was going to be my next question. Do you still give people your mobile number? But you stole my thunder.
The number is still out there, and a lot of people will still have it. Yes, and I still get, I was in Europe sending people back to the customer service line, because I was like, yeah, sorry guys, and I wasn't very responsive, because I would have had to turn that SIM off my travel SIM, so that was an issue too. We should have teleported it by now online and made a virtual number, but we haven't. But yeah, the main number now is virtual and answered by people who are available. So not doing podcasts, etc.
Yeah, that's right. But that just speaks to the, I guess, personal nature, or like the passion that you have to really address this at a human level too, James. So I love that, and that's just one of the things that happen with growth in my perspective that will continue to scale out. But yeah, you'll probably still get random calls at fun times, and that's what we do. That's why we do what we love. I want to come back to Harper for a sec, because we're talking about platforms. I was thinking about what James was saying too, of in-person meetups, and there's different ways that you can communicate with, I guess, the sex worker industry directly, those impacted directly. But there's that whole public narrative too that I imagine is super important to the work you do. Maybe help me understand a little bit more about how you approach that, to do all that cool stuff that you do around education and advocacy in your day-to-day.
Yeah, so I think there's sort of two avenues in which we go about that. So there's, like James was talking about, we collaborate with companies themselves doing business to business and speaking about what is happening and what's coming up, and feeding that back to our community. So that's sort of more our everyday people that we interact with, that we work with, that attend our events, those sorts of things. And that's really helpful to us, because like James said, even when they can't do something, it's really empowering to understand why, and understand where that might be coming from, and how we can find solutions to that ourselves within our communities. And then of course we have sort of our public route, where we talk to people sort of as a whole, or talk to workers that can't see us in person, maybe aren't from somewhere local, can't afford to come, are afraid to come to events, maybe because they don't want to show what they look like to other workers, or depending on the event, maybe the public. So it kind of depends which route we're going. But I think the most powerful thing that we get is that just everyday conversation, knowledge, empowerment that it brings, because we're not offered that a lot as a highly stigmatized group. So just being able to speak to people like James and talk about the service and really understand it, and just give that information back to our community in casual, everyday, genuine, human ways, is the most powerful thing we do. And sometimes we do that just through conversation, just through existing, just through living. Sometimes we do that through talking on larger scales at events, or posting media that is intended to go towards other workers. And then, yeah, of course, speaking about it in ways that we can carefully on social media, talking to the public more about the stigma that we face, and trying to break that down little by little in very everyday, normalized, human to human ways, rather than any one specific big effort or big push. It's really important that we just stay consistent over time, and focus on that human connection, definitely.
Well, and I imagine Nova too, given you've got that background in social work, as you mentioned too. How's that informed the way you go about supporting people navigate healthcare, especially in a system that might feel like trust and support is low or even non-existent?
Yeah, the social work brain can never really be turned off for me. It's given me this lens in which I can view the world and how these systems are supposed to operate, and the difference between how they actually operate and work in practice. And the gap is actually really disappointing sometimes. And in healthcare, it takes a lot for someone to advocate for themselves, especially if they've had a traumatic experience, they've had negative experience with professionals, and in marginalized communities, and for some sex workers, talking to someone with authority or a decision-making power can be quite scary. It can be a daunting experience. So being told no by a doctor or a medical professional can shut them down, and then they're not getting the health that they need. When we're trying to find good services that are welcoming and well designed for sex workers, that is like a trial and error service. So the trailblazers, we're going out there, we're trying new doctors, and if you had a really good experience, we share that with our little whisper networks, and that's through our social networks. Maybe we put that on close friends on social media, say, hey guys, I found like this awesome sexual health service, or I found this great doctor, they were really cool, they understood what I was about. And it becomes part of this unofficial list, which also the same for kind of like a red don't go list, that there's someone had a bad experience with a service. And so those trusted services that we end up keeping this list, they become a key access point to a lot of health services, for many workers. And I think it does say a lot that we have to build these unofficial lists ourselves,
Yeah.
and take on that role of communicating that with other workers.
I mean, it's great that, yeah, like you say, it's great to have that connection, the ability to communicate it, but it's not overly scalable, and you know,
Yeah.
you need to know it's there and all that, and it's reliant on like you say, the trailblazers like yourself and Harper to keep it going. And James, in reflecting on some of those gaps that still exist in the system, I know Hyphen and all the work that you guys do has been quite involved at, in the grassroots level, as you talked about, and participating where you can. What's your take on why these big gaps still exist? And tell me more about the stuff you're doing in it.
Yeah, I think the gaps just exist because the social issues aren't going to go away. The stigma is not going away. And I think the society as a whole has become a lot more sex positive. I think that's more mainstream. Dating apps like Tinder and etc. have really opened the door. Not that hooking up's new. It's just So we are becoming more sex positive, which is allowing it. Then the other issues like rising STI rates, I think we are getting increasing testing. We're diagnosing more than 130 STIs nationwide now, and the more STI testing we do, the higher our rate goes up, and the more positive results go up. So we just need to increase testing everywhere we can. There's still like a big divide, like sexual health still predominantly public health. It is very fragmented outside of that. Every GP, and then very varied experience amongst GPs. So we have GPs refer patients to us for our PrEP health because they don't understand PrEP medication, HIV preventative medication, and that's great that they refer it to us because that's out of their depth. But the patients, are a bit confronted when their GP doesn't have that expertise, and maybe the patient needs that re-education, or should accept that the GP when they are that honest. And at the same time, not all GPs are that honest. They often give a confident answer from Google. Not to dismiss, but like their job is to understand the information, right, and be the medium, because the general practitioners just have to have such a broad knowledge. I think our niche focus, like for us, is really working towards addressing the stigma, and then I'm going to go back to the co-design. Just being having those tentacles in to feed is keep increasing the scope. So we're going to address the systematic gaps by addressing the population at the source, like at the And it's always been difficult too with sexual health, getting that feedback to identify the issues, because people don't give you feedback for the same reason, or they give you anonymous feedback. So whereas the sex worker community has been great, and not everyone comes forward with issues, and advocates like Harper and Nova actually come forward with issues with our service or with public health, or and they bring it to us, which helps us address the problems as well. But I think a big thing in the future is more collaboration between services like ours and public health, facilitating more testing and unburdening them, because they're also overwhelmed. So that also causes more of the problem. I think Melbourne's sexual health clinic has a line up out the door, and we could triage and do probably 80% of those patients, so they don't have to go and overwhelm the system. So just the problem is the demand, the supply and demand not matching and the demand about people not following through. The demand is like hidden because people are not confronting it with the stigma.
Yeah, no, that really hit me in what you were just outlining. It sounds like quite not a economic problem, but quite a transactional problem of the supply and demand, and we've all heard those challenges. It's like, well, we've got a service that could alleviate that pressure, and everyone kind of wins, I guess. But we've got that extra challenge of the stigma and the cloud and all the psychosocial things that come around it that make an important conversation for us to keep having. I guess if we were to round out this discussion here, and then we can keep the conversation going on in the THT Plus community or in other channels too. If given that we've got the ear, I guess, of the digital health ecosystem across people building digital health products and shaping how clinical services are delivered, and even policy as well. If there was a piece of advice each of you would give to those that to help them, I guess, embed trust and dignity and stuff into what they do and have a real world impact, what would that advice be? I might kick off with Nova and then Harper and then James to finish.
I really you said the word dignity, and that was exactly what I was thinking, that these sexual health testing services like delivered through Hyphen is not just about the convenience factor. Sure, it's a really big plus and makes accessing these services really easy for people, but it's about being able to access services with dignity, that it's something that we can just do as part of our health and is something that we need to do for our work. So online services are just such a big shift for us to be able to access what we need without having to explain ourselves.
Yeah, so good. And yourself, Harper?
Yeah, I think I'd almost echo what Nova's saying, because it is so important. I think we've touched so much in this conversation on the idea of how medical professionals are delivering the information, they care for us, just the way they speak to us. And that might seem quite intimidating for someone in that position. And I think that it really is the crux of it, is this is not intimidating or new or hard for us to talk about. This is our everyday. We do this professionally. And realistically, all we're looking for is to just be treated like people, to be treated like it's not something weird or strange. You said earlier that part of the reaction might be shock, and I totally agree, because it's not something we talk about societally very much. So just focusing on not having that shock and you don't need to be knowledgeable on every single aspect and need to know every single thing. We're used to it. We're totally happy to and used to working with you. We just want you to say, oh, sorry, I was actually a little bit shocked because I don't usually have someone say that, but let me help. Let's work together. If there's anything I miss, let me know. If I say something, let me know. And if I don't know something, I will tell you, but I will also be with you on that journey to try and work out how we can resolve that. That's all we really want, is to be treated like any other person, and anything that we can get that leads us down that direction is massively helpful. And of course, that's why Nova and I are such massive advocates for Stigma, as I'm sure you can tell, is because they have been nothing but that. And even when something is less than perfect, they just want to listen to us and hear us and tell us if something can't work. It's totally fine. We just want to be treated like people, like anyone else. Yeah.
So I just thought then too, even I'm hopeful that an episode like this, that someone can reflect and get that initial fight and flight kind of, mode out of the system and go, okay, cool, I'm outside of that need to immediately respond to this situation with something and some people might feel like they need to give advice for some reason or or perspectives, and however they may choose to respond. But the ability to just reflect on it and think, well, okay, now I've dealt with that. Practically the issues that we're talking about, they're not new issues in healthcare in different kinds of settings and modalities and conditions. So no, I feel like that's super useful. James, lastly, round us out if there was any advice or what you need from the ecosystem now to keep doing the amazing work that you're doing.
Yeah, well, for other organizations or anyone starting out, you got to be people first. You got to listen. And yeah, that's patient-centric. And if you're a health practitioner starting, maybe you need a co-founder that's more oriented. So I think we had the perfect mix at the start, GP and young, trying to get some action, out in the market. It's all changed now. But yes, so you just it worked. And then as you go on, you want to keep being inclusive and keep listening to people and keep, recognizing where the different needs are and just it's continuous. It's a continual inclusivity feedback loop.
So good. Look, James, Harper, Nova, I really appreciate you making the time. We'll put the details in the show notes of this episode for people to learn more about the work you're doing and to get in touch with Hyphen as well. Looking forward to continuing to see the great work you're doing. Thank you so much for your time.
Thank you so much. Appreciate it. Thanks, Peter.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.